Hey everyone, welcome back to another edition of the DrBicuspid.com podcast. My name is Kevin Henry. Honored to be the host of this podcast as well as the editor-in-chief for Dr. Bicuspid, and also honored today to have on a good friend and a colleague in the dental industry, and that is Dr. Lou Graham. Dr. Lou, how are you, my friend?
Kevin, it's my pleasure to be here talking with you.
I always love hanging out with you, whether we're in Florida at the Florida Dental Meeting or, doing this. It's always great, my friend. It is. So,
Ditto.
So we've worked together a long time. I know all about you, but I want to make sure our audience knows all about you and a little bit about Catapult as well.
We're an organization that is 21 years old, which is absolutely crazy. We're a speaker bureau of, I think, just wonderful speakers. We're an evaluation group. We have 38,000 subscribers now, and I've been a dentist clinically for 40 years. So I think, Kevin, like you, I've seen quite a bit of change in dentistry.
And I know there is more to come. And I know that's one of the things we're going to talk about today, because one of the big trends, I think, heading into 2025 are these GPOs. And you and I have talked about that, these buying groups where dental practices can come together. And so would you just kind of give me that 30,000-foot view? What is a GPO and why is it important in today's dental industry?
The way to explain a GPO is a dentist should think of like a buying group. And whether you want to call it like Amazon Prime or Walmart, the key part of a buying group is collectively, if you're part of a buying group, you have much more negotiating and buying power than as an individual dentist. And I'll say it like this. 60 years ago, even 40 years ago, the vast majority of dentists were solo practitioners. We've all seen the shift to DSOs into the marketplace. In the last 40 years, we've seen a huge growth of PPOs. So dentists individually have got to start thinking, how do I literally lower my variable costs and think like much more business smarter? And that's what DSOs do. DSOs collectively for their offices run smarter businesses, and dentists can do that keeping their own individuality. They should be participating in a buying group.
So are buying groups successful outside of dentistry? I mean, is this something new to dentistry? I'm curious for your thoughts here as we head into 2025.
There are definitely, I would say, successful buying groups in dentistry. The majority are small, and the majority are complementary. From the manufacturer side, and we're not just talking dental supplies, they don't see a lot of uptake by the dentist because they're free. And the dentists then have to go figure out how to find all the deals. And so traditionally, that's been a typical buying group. Outside of dentistry, it's crazy, Kevin. 98% of all medical offices and hospitals are in a buying group. Veterinary medicine is very similar like to dentists as far as independent dentists. There are now DSOs in vet. Vets have gone from almost no participation in a buying group to over 60% in just 3 years. And when you go into a vet office, you're going to see the same things like in a dental office, except obviously it's animals, not humans. But there's been a huge uptick in the success in optometry. It's over 90%. And so dentists are really participating at a much lower level, and even at a lower level on really taking advantage of the buying group opportunities.
You and I both know some of the big issues that are out there that dentists face right now: insurance reimbursement, staffing shortages, a lot of things that we've dealt with for a while in our industry. And to be honest, 2025, it doesn't look like it's going to get a lot better. So how does this kind of help take a little bit of the load off of the dentist in your mind?
So let's start with Delta Dental. They're not going to like what I'm about to say, but I don't like Delta Dental, so it's okay. Inflation has been a huge issue, and it's been even a bigger issue since COVID. This has nothing to do with politics. Inflation and rising overhead have been a predominant problem in dentistry, and I'm going to get to staffing. In my course, I will show, or someone can go Google, has Delta Dental raised reimbursements in 2024? The answer's no. 2023, no. 2022, no. So how does a dentist deal with, and there are 156,000 dentists who participate in Delta Dental, and they're not going to raise their reimbursements because they're out there competing against other insurance companies. So, I mean, this could be for 5 other podcasts, but dentists have to realize you can only save so much money on dental supplies and labs. And we have great, great partners. We have an onboarding team. But what you really need to do is really start with having your UCR fee analyzed. And we have a company that partners with us, and they do that complimentary. And then they do a reduced fee for each office to go in and negotiate higher reimbursements, but also tell the office, maybe you should drop out of these 3 PPOs and take a look at these 2 because their reimbursements are higher. So we've negotiated great opportunities in that area, and there's a huge savings opportunity. B, staffing. I will tell you, Kevin, that this is probably the biggest problem in dentistry today.
Okay.
If you lose a staff member, Roger Levin's group showed that offices have to cut down their hours until they can actually make up the time with the right staffing. Or is a doctor now doing hygiene because they can't find a wonderful or a great hygienist? So again, here's a great stat. 21% of dentists individual dentists and small groups offer their team members medical benefits. Well, 80% of DSOs offer medical benefits. So who are you going to go work for? You're going to go work for a provider who's going to offer you benefits because a dental assistant needs medical benefits, a front team member. So what we've done is we actually go out and negotiate with PEO brokers and other vendors to reduce your medical premiums, and that's what DSOs do. And it's the same United Healthcare, Blue Cross Blue Shield. So we have taken all of that into our fold so doctors can save money on benefits and hopefully increase staff retention. And that becomes another part of a good GPO.
And I also love the fact, and tell me if I'm wrong here, because we have so many new dental assistants who come in, and there's a lack of training out there. There's a lack of time to train them. And so often, these assistants have a role whenever it comes to ordering. They have a role whenever it comes to making sure the shelves are stocked. And so to have a GPO, really, I think, and tell me if I'm wrong, it helps eliminate some of that learning curve about how to order, who to order from, all that good stuff, correct?
Correct. So we have 2 ways of doing it in our buying group. One is it's an open platform with select distributors we work with. So we have our own formulary, but it's an open formulary. You can buy really great products at great savings. But let's say you want your bonding agent or you want whatever. You can still get great savings, but it's just not in our formulary. So an open platform would be the dental assistant goes into our partner platform. It's all driven by AI. It has budgets for the office and everything. And an open platform means within our GPO, and this I think makes us very unique, they can get best pricing from our 3 distribution sources. If they want to just go online and order from one of our distributors who participate in Catapult, and they only want to work with one, we absolutely offer that. So we offer both opportunities, online ordering or phone, but online so much more efficient. They don't have to shop for prices. We're already doing all that. So the assistant is in the chair, not spending 5 hours a week trying to find the best deal.
And I think that's music to a lot of ears out there. Let's be perfectly honest here. And I
Yep,
know that there is a fee involved with being a part of a
there is.
GPO. Yeah. So tell me why, and tell me the benefit of paying that monthly fee.
So we charge $99 a month. So think of a dinner, whatever, $99 a month. Why? The majority of other GPOs or buying groups, they send you a list of where you can order from. We have a personal onboarding team. And so what they'll do is they'll go, Dr. Graham, tell us your 5, touch points that you want to save money on. Let us connect you personally to the vendors personally and get this going. So let's not even talk about dental labs or dental supplies. We have, I think, unbelievable savings in both. I mean, we can save an office tens of thousands of dollars probably with 4 or 5 of our partners. So $99 a month is a no-brainer. But let's just say you want to save on credit card processing. That's the new hot button. We've already got 2 partners with 2 different solutions. And on average, we're saving our offices about $200 to $300 a month. I mean, obviously it covers the membership and far more, but now you're handed off to their teams. So Kevin, I don't know about you, but I want personalized service. I don't want to click one button, then click another button. I want to be handed off. So if you want that personalized touch, that's what I think as a dentist, that's what I wanted when I created our buying group.
And, another hot button right now is outsourcing. And it sounds to me as if whenever you're with a GPO, especially yours, that it's something that if you need to have this eliminated, this taken care of, that you can actually hand that off and people can be working with you to, as you said, the credit card processing, things like that, that maybe you don't think you've got time to do right now, but you can turn it over to a GPO to help you with that, again, for that cost.
So let me just say, in 15 minutes, I can connect an office to our credit card processing partner. I know them by first name, Jim and Ray. 1 month of processing statement, and within 24 hours, you're going to get an estimate back, and you're going to be like, I can't believe how much money I've lost over the years. And there's this whole thing about zero charge. There is no zero charge in credit card. That's a scam, because that means the patient's paying the 3%. We've just negotiated with these companies for great deals. The same with brokerage companies for staffing, benefits, retirement plans. Whatever a dental office wants, we, as a dentist, I know the pain points. Also a pain point, Kevin, is contracts. I hate contracts. If a dentist doesn't see the value, they can drop out anytime they want. And once they're saving money with us and they're seeing the value add, and then we bring education in, we get discounts in education, both online and live. I get excited because there's so much value add, and you can save money, but you also want to take great courses. So we've partnered with great implant companies, great discounts, but great education companies. So if you want to go take a live veneer course, live implant courses, and those are expensive courses, we've negotiated with the leaders and we continue to expand that, then you save thousands and thousands of dollars just on one live course. And you're only going to grow your practice through education. And that's what we believe in as an education company.
I just want to emphasize something you said just a moment ago. No long-term contracts, correct?
Oh, it's month to month. Once you're saving, you're not going to stop. But if someone wants to drop out or they've sold their practice, it's a month-to-month contract.
Honestly, as we're starting a new year, as we're looking ahead to what we can improve in our dental practice and our dental business, finding out how to save money, that should be at the top of everybody's list. So how do they learn more about the GPO from Catapult?
So 2 things. As a clinician, I did not want to be bothered with what we're talking about. I love my patient interaction. I don't want to be involved in what we just talked about. The person who does all of this is your office manager. And we work with office managers. Now, the dentist can make decisions on formulary and purchasing, and labs, but even just like, and I'll tell you how to get into, even our lab partners, when you join, you get complimentary implant crown, you get a complimentary implant crown and multi-colored, multi-layered zirconia crowns or EMAX. We want the dentist to feel the value there. So to join or to even just learn about us, Kevin, you go to www.catapultgrow.com. So it's one word, catapultgrow.com. And we'll have our onboarding team reach out to you. And the first month is complimentary. Why? Because it's going to take us probably at least 2 weeks to onboard you, work with your office manager. So by the time you pay your first $99, you probably have already saved, I'll just say on average, $300 to $1,000 in your first month, and that's just getting it going.
We're going to make sure to have the link in the show notes, or if you're reading this on drbicuspid.com, it's absolutely in the article, very easy to click through. And I'm really excited because I know Catapult and Dr. Bicuspid are going to be working together closely in 2025. And I'm excited about that partnership as well and what it's going to do for our readers.
Great. It's win-win for everybody.
That's what it's all about, my friend. Hey, Dr. Graham, thanks so much for hanging with me for a few minutes today and explaining GPO and what it can do for dentists out there. I really appreciate it.
My pleasure, pal. Thank you.
And hey, thanks to all of you for listening to this episode or watching this episode of the drbicuspid.com podcast. Absolutely. We'll be back soon with another edition that's going to help you and your practice have a better 2025.